I'm Toni Pichette. I am a certified ophthalmic medical technologist with BayCare's Green Bay Eye Clinic. I've been in the field for about 25 years now. I started out with an associate 2-year degree as an optician from Lakeshore Technical College. So what that means is I was trained into how light travels through lenses, how to make eyeglasses for patients. This was my true passion, though, to be an ophthalmic technician. And so when the opportunity arose at the Green Bay Eye Clinic, they brought me on, and I've learned and been with them, as I said, for the past 25 years. How it all started was when I was in 5th grade. I went in for my own eye exam, and the optometrist I was seeing, he must have realized some sort of spark inside of me, and so he actually took one of his instruments, and it was like a flashlight. We call it a direct, I know that now. At the time I didn't. He lined it up just perfect in front of his eye and allowed me to see inside of his eye. And I saw all the blood vessels and the vasculature inside of there, and it was exciting, and so it's something that stuck with me. I went home and we were planning my classes for high school and education beyond, and I said, this is what I want to do. These are the classes I need to take. After that, then, as I said, I wound up eventually, after my associate degree, working in the opticals a little while and then coming to the clinic where they trained me into the medical end of this. Part of the thing that's different is people don't realize the difference between a regular medical assistant and an ophthalmic assistant. As a medical assistant, I kind of do some of those duties also as far as taking histories from patients, checking their vital signs once in a while. But it's important for me to have a better understanding of how the eye works, how the light is focused into the eye, how the blood supplies come into the eye. And that understanding allows me to do further testing. So here at the clinic, if a patient comes in, I've been with my physicians a long time. They know my work, they trust my work as if I were anybody else's registered nurse working with general physician. And they allow me to do a lot of the pre-testing. So if you were a patient coming in, I would be responsible not only for checking all the things already mentioned with your vitals and your medications and your health, but also I would have to check your vision, the pressure in your eyes. I would have to perform certain ancillary testing. So like if the doctor thinks you have glaucoma, he may want special tests of the optic nerve in the back of your eye. I would be responsible for checking your glasses prescription potentially. So when that doctor does the thing we all hate, the which is better, 1 or 2, and we can't decide, that falls back on me. My doctor takes those measurements and looks to make sure they make sense. Sometimes they do, recheck them if they don't, and puts that all into interpretation of, do you just need a new pair of glasses, or is it time to have cataract surgery, or do you have glaucoma? Do you have some problem with the back of your eye, like the film in the camera, and what can he do to help you see?